When we think about systemic diseases, it's important to remember that the eye is not an isolated organ. What happens in the body often shows up in the retina, the optic nerve, or other ocular structures. Today, we're going to focus on 3 major systemic conditions that have important and sometimes devastating eye consequences: diabetes, cytomegalovirus infection, and hypertension. Diabetic retinopathy. Thanks to better diabetes management, people are living longer, but that also means we're seeing more long-term complications, and diabetic retinopathy is one of the most serious. This condition is a leading cause of vision loss in working-age adults. Patients with diabetes are also more prone to cataracts. Diabetic retinopathy damages the retinal blood vessels over time. It can cause microaneurysms, hemorrhages, exudates, and eventually neovascularization, the growth of fragile, abnormal vessels. These vessels can bleed, scar, and pull on the retina, leading to detachment. Preventing and controlling retinopathy means strict blood sugar management, controlling blood pressure and lipids, and regular eye exams. Early detection is key because the patient may have no symptoms until the damage is advanced. Cytomegalovirus retinitis. In patients with AIDS, one of the most common and dangerous eye infections is cytomegalovirus retinitis, or CMV retinitis. This infection attacks the retina and can lead to severe, permanent vision loss if untreated. Symptoms vary. Some patients notice floaters or loss of part of their visual field, while others experience blurred vision from macular edema. As the disease progresses, the retina thins and becomes fragile, making it prone to tears or detachment. We see CMV retinitis in 3 main patterns. Hemorrhagic, where areas of necrotic retina are mixed with retinal hemorrhages. Brush fire, where a yellow-white front advances from an area of old, atrophic retina. Granular, with white speckled lesions that expand slowly in the retinal periphery. Treatment focuses on antiviral drugs. Ganciclovir can be given intravenously, orally, or directly into the eye through injections or an implanted slow-release device. Foscarnet and Cidofovir are alternatives or can be combined with ganciclovir for better effect. All have significant side effects, especially kidney toxicity. Close monitoring is essential. With effective antiretroviral therapy, many HIV patients now live longer and the immune system recovers. Ironically, some then develop immune recovery uveitis, an inflammatory reaction in the eye. This can cause cystoid macular edema and scarring and is treated with corticosteroids. Hypertension-related eye changes. Chronic high blood pressure also leaves its mark on the retina. Over time, we see narrowing and twisting of the arterioles and changes in their light reflex that make them look like copper or silver wires. At the crossing points of arteries and veins, the artery may compress the vein, a finding called arteriovenous nicking. Small flame-shaped hemorrhages may appear in the nerve fiber layer of the retina. When blood pressure spikes suddenly, as in malignant hypertension, preeclampsia, or certain endocrine crises, the damage is more dramatic. We can see cotton wool spots, retinal hemorrhages, swelling, and yellowish exudates, often clustered around the macula. The choroid can also be injured, leading to retinal detachment or even infarction of the retinal pigment epithelium. In severe cases, the optic nerve swells, a condition called papilledema. The critical point here is that blood pressure must be lowered carefully in these situations. Too rapid reduction can deprive the optic nerve and brain of needed blood flow, making the problem worse. Key takeaways: systemic diseases like diabetes, HIV infection, and hypertension don't just threaten the heart, kidneys, or immune system. They can rob patients of sight. As clinicians, our role is to detect these changes early, coordinate care with other providers, and educate patients on the importance of controlling their systemic disease to protect their vision.